Hello, my name is Dr. Hayley Reed, and I'll be talking today about my PhD research, which focused on co-production in secondary schools. And I'll be specifically looking at using photography and the Schools Health Research Network data to explore students' understandings of wellbeing as a form of self-assessment within secondary schools. If anybody would like to discuss any other further issues in terms of the PhD, my email address is on there. Please feel free to get in contact with me. So just to give you an overview of what I'll be talking about, I'll start off by giving an overview of the PhD, what we aim to do and how the PhD looked in terms of its design. I'll then focus on the two different areas in the PhD. So we had two phases in terms of a review and then an evaluation in secondary schools. I'm going to specifically focus on problem setting as a way for schools to be able to understand wellbeing within their settings. So using photography, SHRN statistics and a prioritisation task to do this. And then I'll be talking about why this research is important to schools. So the overall aim of the PhD was to develop a co-production process that could be used in schools to target wellbeing. And by target wellbeing, I mean to develop action plans to be able to address any issues within the school system. In terms of how we defined co-production, people will understand that there are lots of different terms used in terms of involving people, such as pupil voice or participation. We use the term co-production, and I defined it as involving members of the school in problem setting. So that's understanding the problems within the schools and what drives them, and then problem solving in terms of developing up solutions or activities. And people had to be involved in the decision making for these. So the PhD had two phases. They had initially a review of studies which had already used co-production in secondary schools to change students' health. And this was really to understand what had already been done, but also I looked at stakeholders' experiences of these processes to work out what they thought worked well. This was also to help me to decide what co-production process I would use in the second phase of my research, which was about running co-production in two different secondary schools to evaluate what happened in the co-production process with those involved and to refine the process. And I'll talk a little bit more about this in a second. Just in terms of the very bottom of this slide, there are two resources people can look at in terms of the review. So we have published on the review an academic article, and also at the very bottom is a link to a blog post for schools to understand the review more in depth, because I won't be talking as much about that today. However, an overview of the review is that three types of co-production were found. So I found three different ways in which schools already, or researchers within schools already run co-production processes. The first was external capacity building. And this builds capacity outside of the school. So for example, researchers or facilitators increase their knowledge of co-production processes, such as career and dialogue circles, and then they use these processes within schools. The second was individual level capacity building, where I found 9 studies where students were developed as student researchers or leaders through delivering them a co-production or training on research and curricula. This meant that the students themselves run research which helped them to problem set and problem solve within the setting. And this could involve just other students in the research, or some did involve some staff members. And the third way we termed system level capacity building. So this is the development or establishment of research action groups. So these are groups consisting of multiple members within and external to the school, supported by a facilitator, for them to be able to understand the school setting and problem set, and then decide on their priorities. And just to let you know, the way we decided to use in the second phase was the system level capacity building. Now, this was for two main reasons. First, we found 4 main studies within the 7 studies in this section, which were emulations of each other, which meant that they developed up real strong understandings of the processes of co-production for me to be able to follow. The second was when we looked at the experiences of members within the research action groups, the students and staff and senior members, we found that actually, in comparison to the other capacity building levels, that the ideas developed up were more likely to be introduced in system level. And this was mainly, we feel, because it wasn't just students involved in the problem setting and solving decision making. So in individual and external capacity, it generally tended to be students made those decisions, and at the very end, their ideas went to senior management team to be adopted. However, within the system level capacity building section, we found that actually many people were involved in the problem solving and setting. So this could be students, school staff, senior management team, governance, parents, which meant that actually ideas were more likely to be taken on. So here's an overview of the process, if you like, and I won't talk too much in depth about this, but the one thing I would like to highlight is, as you see here, we have the resources. So we have what we needed to do the co-production process. So an external facilitator to support, school data, and this is where I'll talk about photography and SHRN data. And then I did put together some group kind of manual in terms of suggested activities which schools could use. I think when we think about the functions, so what schools actually did, so the research action group's functions, you'll see here, for example, I've put recruitment, but I wasn't very prescriptive on exactly how schools could do recruitment. I gave suggested or preferred ideas in terms of, for recruitment, running assemblies about the research action groups and allowing students to nominate themselves. However, we did leave it quite open to schools to be able to have some say on how this would work in their own settings. And what I'll be focusing on today is this level here, which is problem setting. So schools developing an understanding of what wellbeing means within their setting to try and decide on the health targets they would focus on in action plans. So the second stage, as I said, was an evaluation. So we established research action groups with multiple schools and external stakeholders in 2 schools. And the idea of this was to develop wellbeing plans. To inform the research action groups of the school's wellbeing, we used, as I said, a photography project with students to help them to try and elicit what they thought wellbeing was. And one of the things we know from the literature is that wellbeing is quite a contested concept, and it means different things to different people, which is why it's really important here that we did this at a school specific level, because wellbeing could be very different in different schools. We also accessed the results from the school SHRN report. I then supported schools to hold 4 research action group meetings where they looked at their data and they did activities which helped them to problem set and problem solve. In terms of me evaluating this in the 2 schools, I used my own perspective in terms of I kept a research diary, and I did observations of both the photography with the students, but also the research action meetings with all members of the school. I did surveys and interviews with members of the research action groups. So in terms of the surveys, they were initial kind of quantitative surveys to get people's understanding, and then I kind of delved into them a little bit more into the interviews. And I suppose it's important here to say we actually had 10 students in the one school and 12 students in the other school, ranging from year 7 to year 12. And we had 4 members of staff within each research action group, which did in both schools involve the wellbeing team, but also somebody from the youth service. So we had a youth engagement officer in one school and a youth mentor in the other school. And then the last thing I did in terms of the evaluation was focus groups with senior management teams, get their understandings of wellbeing plans and whether they fit the school. So the photography project, just to give you an idea of why I actually did, I worked with young people or students, like I said, 10 in one school, 12 in the other school, on a one-to-one basis. They came to me, we discussed wellbeing, they took cameras away, and it was really negotiated with them how long they would have the cameras. And some students needed more support than others in terms of thinking about wellbeing. And I used a card which we used from a very well-known kind of survey within wellbeing to try and help students who couldn't think of things in terms of wellbeing. We then added to this the SHRN data from the whole school about each of the themes which were developed up from the photography. So I brought together the ideas from the photography and brought the data from the SHRN reports where it was applicable. We then did a prioritisation task in terms of a diamond ranking, where in each school they prioritised their themes from the most to the least important. And we did this in 3 different ways. We did it with the younger students in the research action group, the older students in the research action group, and the staff members. And then I scored each of their diamond rankings to be able to think of what was overall the priorities. Then I took these back to the school research action group, and as a whole, they did an exercise where they decided whether these were the action groups, the top 3, top 5 actions they should focus on. So this is just a card. So one of the things people have asked when I've talked about this is, what does the data look like in terms of what you give schools in terms of the prioritisation task? So this is just one of the themes, which was bullying in one of the schools, where they were given back their SHRN data in terms of what we knew from the whole school instead of SHRN. Their photographs, and I've used quite a generic photograph here, obviously to maintain the identity of the school, and then kind of an overview of what was said within the interviews with students. So what do we find out about photography? So 100% of the students who were part of the research action groups took part in photography and were very willing to take part in photography. It was an activity they thought which they didn't usually have an opportunity to be part of in schools, and really enjoyed that. 82 and 79% rated this photography as very useful to understand school wellbeing. And overall, students thought it was acceptable, fun. They liked the idea that they were able to walk around and be quite physically active rather than just sit in a room talking to a researcher. And they liked that they didn't have to do much writing. They also expressed that they thought actually walking around and being immersed in the school environment actually helped them to think about wellbeing ideas. So they thought there were wellbeing themes or ideas they developed up which wouldn't have been possible if they were just interviewed by a researcher. They also thought it was important that their participation was negotiated to accommodate individual preferences. So, for example, how long students had the camera, if they could come back and speak to me in between, and also just in terms of whether they did this in school time or whether they did this, in lesson time, or whether they did this outside. Some of the students felt they would feel embarrassed taking photos at lunchtime, so they were given some time within the school day. And throughout this presentation, I will highlight a couple of quotes, which you're able to read, and you'll have the slides afterwards. But it's just an example of what I'm trying to talk about in terms of what students or staff have said. And this again was about them noticing more because they were doing a kind of an activity walking around the school. Staff felt it allowed them to see wellbeing through students' eyes much more than if they just had data. They felt it was a much more effective emotional reaction they had in terms of understanding students' experiences of wellbeing, and it just made it a lot more personal, brought it to life. They were actually surprised by some of the themes which are raised. And this is a quote from a staff member who talks a lot about and did highlight the fact that staff are members of the school, that they actually see things very differently to students. So the SHRN statistics, again, we had quite high levels, 64 and 47% rating that the SHRN statistics were very helpful to understand school wellbeing. And it's important to say only actually one person in the whole study thought that the statistics were too difficult to work with. Students and staff thought that they added more detail to the themes, which was really important. They thought that it helped in terms of comparing themselves to other schools, whether you want to do that or not. Whether this was an issue they could target at the whole school level, or whether there were specific years or specific genders they could focus on. So for example, in the one school, one of the main things which prioritised were student-staff relationships. And what we could see from the SHRN statistics is that actually year 7 and year 8 students were quite happy with their staff relationship, their relationships with staff, and that tailored off at year 9. So it was towards the end of year 8 they wanted to do some work before that deterioration. Obviously involved data from the whole population and not just the research action group students, which is sometimes a criticism of co-production. So having very small numbers of students to do this work with is sometimes, like I said, criticised, but we did have data from the whole school, or high levels of the school, if not all students had done the SHRN questionnaire in their school. Staff did say that it helped to tackle what they thought in the SHRN report. So some staff talked about there was lots of information in the SHRN reports and they didn't know where to focus on. And again, this is just a staff member talking about, thinking about the statistics and how useful they were. Lastly, the prioritisation task. So again, we had high levels of research action group members thinking this was a very useful task. And I said, now, this was the diamond ranking exercise. They thought it was a very acceptable way to do it. And it was a really good method to stimulate the group discussions, which was the important thing in terms of prioritisation tasks. It wasn't the prioritisation itself, it was the cooperative processes they went through to discuss each of these themes, which they thought was really important. Although they did feel that there was lots of data to get through. So in one school, they had 20 themes, in the other school, 18 themes. So the students had developed up quite a lot of themes. So this is a task which takes quite a long time to do. And people talked a lot about how they did this in terms of how they focused their time in the task. So for the younger group in one of the schools, as this quote says, they really focused on getting together what they thought were the top ones and really focusing on them and not focusing on talking on the bottom ones that much. Some participants did feel they could make a case for, almost all of those themes to be in the top, which was quite interesting because when I went back and looked at some of the observations from this task, it clearly showed very early on that the groups had really clear inclusion and exclusion criteria. And this is one staff member talking about the fact that they really focused their inclusion criteria on deciding the priorities through thinking about what affected most of the students in the schools, the wider population. Now, arguably, you could look at it a different way and think about what affected maybe not most of the students, but had a higher severity on their well-being. But this was how they decided to do it in that school. And what really came across is that it was actually the combination of these three methods. So it was about the photography, and the photography offering them staff an insight into how students experience well-being. And the photography again helped the students to think about that and develop up those ideas. The statistics added to that to give nuance to the photography themes. And then the group discussions were really where they felt they had those kind of conversations about, okay, well, we understand the information within the school, and the discussions were focused on, okay, how can we prioritize them? And again, this is actually a student member talking about how it was really important to triangulate those different data sources, and how each of them were just as important as the other. So lastly, sorry, I'm just going to talk about why this is important to schools, this research. So currently within Wales, there's kind of a unique set of national contextual circumstances in terms of education reform. This on multiple levels has reorientated schools to co-production cycles and kind of routine co-production cycles with members within the school and externally to address health and well-being. So one of these areas is the framework on embedding a whole school approach to emotional and mental well-being. So as I've got here, we have the steps or the figure, which is from the guidance of the framework, to note out that this maps very well onto the co-production process that I have produced and put together. So we have this scoping stage where schools self-evaluate, and part of this includes getting key stakeholders' views, so from staff, parents, learners, governing bodies, to be able to kind of share their views and share decision making. Also within this process, I should say that one source in that document, which has been forefronted as a good thing to work with in this process, is the SHRN data, as well as others such as the Welsh Network of Healthy Schools schemes, which I'll go on and talk about in a second. But obviously it also maps onto the action planning and then the evaluation, as I showed in my a slide of the kind of graphical representation of co-production. Also, the new curriculum for Wales, as people will know, obviously outlines 4 purposes, including the aim to develop healthy and confident individuals, and that one of the 6 learning areas is focused on health and well-being. There's also considerable overlap in the curriculum's guidance in terms of the core learning statements for health and well-being. So such things as students' recognition and being able to understand what affects their well-being so they can remediate that. And also students' ability to kind of critically evaluate and make decisions based on health and well-being. And this is both at the individual and group level that the guidance talks about. You know, this guidance does say that schools should be giving students opportunities to make decisions on problem setting, solving, to critically assess information and bring together kind of cooperative group activities for them to be able to discuss and understand other people's opinions on well-being. So again, this maps on very well. And aside of that as well is schools as learning organisations, which really, again, focuses on that developing a shared vision of how you can change or enhance wellbeing outcomes within the setting by involving multiple stakeholders. So the last thing I want to discuss was about kind of how this can be used within schools now then. So arguably some people would say that we're adding load into the school system without increasing the capacity of members of staff, etc. But the way I've tried to frame it is about thinking about how we can redistribute what is already within the school systems and the wider education system for schools to be able to support this process maybe themselves. So first off, we have school councils, and you will have dedicated staff members who are already running school councils, doing recruitment processes with students, and that is a mechanism which you could expand to involve other members of the school community with to do these co-production processes. Also, this could be something in terms of, I said, in both schools, they really nominated people within the wellbeing teams to be able to be part of these processes as a form of being able to think about proactively changing wellbeing. So again, using those wellbeing teams and dedicating some of their time to this may be productive. Also, as I said, in both schools, they drew on external members who were actually those within local authorities who had been assigned to schools in terms of some kind of youth support services, youth engagement officers and youth mentors. And in both schools, both of these members of staff were really happy and really excited about being involved in something really proactive with students to be able to think about well-being. So again, is it those resources you could work with? The last area really is about the Healthy Schools Network. So we already have Healthy Schools coordinators, which can help schools, and they already have 3 annual health actions, which a designated member of staff in your school will be helping to support what those health actions are. So repositioning already towards using school data has been something we've seen in terms of the Healthy School Network. And again, it's about whether those resources from the Healthy School Network can be brought together within this research action group kind of structure to be able to support schools. So again, this is really about making the load more manageable as well. I've talked quite a lot about me working one-on-one with students in terms of photography. Now, this took a very long time, and it's something which maybe is not possible for schools to do themselves. But it'd be interesting to hear from staff about how we could use photography, as we've seen it's such a positive process for students and staff. Use photography maybe in a different way. Could it be used as part of the health and wellbeing lessons in terms of the new curriculum, where you do this at a class level? Students are asked to use photography to think about wellbeing, and then in terms of that, then they're asked to put forward their 1, maybe 2 priorities and write a paragraph for each of the photographs for students to express what they mean by that well-being. And then it would be for these research action groups to collate that. So we are thinking about as well kind of making that load more manageable, but it is something I would really like to discuss at the end of this presentation. And also leading on now to me finalising, I'd also like to talk to staff members about how they think the best way to disseminate this work even further would be. So thank you very much, and please feel free, like I said, to contact me if you don't have time to discuss the requirements today.